My name is Yvonne Livingston, and I'm the Community Engagement Coordinator at the Urban Youth Center. And what I do there is I'm a parent at the table, and we have open and honest conversations about what it is our families come in for. And it's a great, lively discussion. And a lot of times medication comes up. And while I'm not what I want to say, like I've never taken it, but I know the use for it, and I know that it can be great for our people that need it. And so I want to introduce to you my girl, Kelley. So Kelley, take it over.
Hi, hello. My name is Kelley Volpe, and I am a psychiatrist at the University of Illinois in Chicago. I specialize in child and adolescent psychiatry, and I work in our pediatric stress and anxiety disorder clinic that is associated with the Urban Youth Trauma Center. And I do, in addition to working with children and adolescents that have anxiety and trauma related disorders, I also do a lot of teaching of psychiatrists who want to work with children, and also social workers, psychologists, undergrads. I do a lot of teaching and training in that regard. And I also am a mother of three. I have three children, Jack, who is 9, Josie, who is going to be 6, and Charlie, who is the baby, 3 years old.
Okay, cool. And so I'm also a mother. I'm a mother of 6, um, and 4 sons and 2 daughters. And I'm not going to do all of what you just did because, if they were younger, they would probably think it was cool, but now they're older and it's like, stop telling all my business. Oh, wait, they did that to me when they were younger. They never wanted me to talk about them at all, really. Um, and sometimes, as a parent, when you talk about your children and you want to get them help when they're dysregulated because, you're dysregulated. So, I'm gonna talk about me. Okay. And so being that I never got diagnosed for anything, I did occasionally talk to mental health professionals. And the one time I did speak to a psychiatrist and wanted to give me medication, I refused because I was pregnant.
Mhm.
And so I didn't, I wasn't knowledgeable enough to understand what the medication was going to do to me, let alone, my baby. And so it wasn't really explained to me the benefits of it because,
Right.
I do believe, what the doctor did see was depression,
Mhm.
because that's what I had, right? But I just wanted to talk to somebody,
Yeah.
because I didn't know what the medication would do and, all of I'm just not a doctor like that, right?
Mhm.
Um, and so I wasn't savvy enough to advocate for myself back then to ask these type of questions. And so going through, the psychology program at UIC, I got a little peek at what the medication does and how it's helpful. And so what I want to ask you, Kelley, is how can medication be helpful for people who are diagnosed with mental illnesses that could use the benefits of the medications?
Yeah, I think that there's lots of ways that medications can be helpful. Really, depending on depression and anxiety. Um, and what one of the things you mentioned is, when you went to the doctor, and I think this happens often, doctors will have a lot of information about why they want to prescribe a certain medication, but maybe not do the best job of explaining this. And
Mm-hmm.
in order, for medication and mental health, especially working with children, but also working with adults, really that education and helping the other person understand has so many benefits. Not just the benefit that you had already mentioned, that if people understand why the medication is being chosen, they're more likely to agree to the treatment plan, but also further down the line, if people really understand why the medication is being chosen, it's more likely that the medicine is going to be helpful, that they'll stick with taking the medication, that they'll communicate with their doctor about any problems they're having with the medication, which just, really leads to the medicine being helpful. So, talking about what benefits, specific benefits that there are for the medication, most of the medications that are used to treat depression and anxiety tend to be the same medication, and they really help with those core symptoms of depression and anxiety: worried thoughts, low mood, difficulty getting out of bed, panic attacks,
Mhm.
um, things like that, that come up, suicidal thoughts, all of these symptoms of anxiety and depression. And for people with anxiety and depression, it's really those symptoms that keep them from being able to live their everyday life, from going to school and spending time with their friends. And one of the things that's often not spoken about with medications is, well, what happens if you don't take the medicine, right?
Mm.
So if you have a kid with anxiety or depression, and they're not being treated, they do miss out on a lot. They miss out on developmental milestones, right? If you're not going to school, if you're not socializing with friends, you miss that learning, you miss that those experiences in that phase of life, and it can affect child development. And so there's a lot to be said, and it's important to understand the risks of taking a medication, but it's also really important to understand what are the risks of not taking a medication or not doing any treatment, which also includes therapy and including that in treatment. Important to say.
And so as you were speaking, I was thinking to myself, um, like when when the medication was offered, right, to me and I refused it. And I didn't go back after then, So I suffered, because I didn't understand, right,
Mm-hmm.
um, what the medication was going to do to myself or the baby. And so going through the pregnancy, depressed, um, you know, really did something to me, right? But then not only did it do something to me, it also did something to my child.
Right.
Um, and so that's kind of that's the reverse effect of, right. Had I taken the medicine, who knows what mood I would have put myself in, right, from doing that, and also improving, right, the and then catch me if I'm wrong, because I'm still a student at this. Um, well, we started talking about epigenetics and, right, how trauma passes through, the bloodline, right? So
Yep.
had that been interrupted, while I was carrying, right? Is there a possibility, right? Not, and I don't want to tell all my children's business, but as a dysregulated mother, I understand that the developments that my children had came a little short because I was short, temperament and everything else that I was going through around me. I still passed it on to them, you know, and so that's usually, you know, why the medication helps and why it's a good benefit. So you don't pass on those things. Um, and so, now in hindsight, right, that's
Right.
that's sometimes what I think about, you know, how would my life have been different, if things were explained to me a little bit better about the benefits. And that education piece is so important because a lot of times we base our information on, what we've heard in our communities, you
Right.
know, because of experiments and things like that. And so those stories they're continuously handed down because of the mistreatment and the experience of doctors really not listening. And so that gets transferred into any medical space,
Yeah.
as not
Yeah.
being trustworthy.
Absolutely. And I think, like hindsight, it's really, looking back at hindsight, that's a really important idea because really I see myself and doctors as our role is to provide someone with the most information that they can have so that they can make the best decision in the moment, right? And really trying to understand the person we're working with, but acknowledging that the person we're working with knows themselves and their life the best. And so they
Mm-hmm.
really have to be the one to take the information and say, like, what is going to be the correct decision for me? And we get this information, it's important for doctors to be the voice of, what do we know in the evidence and the literature and the research, and also understanding what's out there in the community because like you said, a lot of what people know about medication happens to be from what they've learned in the community, if they've had friends or
Mm-hmm.
family on medication. And I'm really glad that you brought up the idea of pregnant women and mothers because there is a really strong idea in the community, and not even just in the community but also the medical community, that it's okay for mothers to suffer if it means that their child is going to do better. And so don't take the medicine because you should be suffering, like lots of things like that. are out there. And I think it's really important to say that, moms don't have to suffer to be a good mom, right? And you don't have to, taking the medication, if for exactly what you said, that suffering doesn't make someone a good mom. And putting their kids' needs before them doesn't make someone the best mom. But taking care of oneself and taking the medication if you need it, so the depression is helped, the anxiety is help someone be a better mom, to their children. And so, really looking at it that way, not like, oh, what are the risks of the medicine to the baby? There are a few, but there's also risks of, untreated mental illness to the mom and to the baby, right? And we have to be thinking about families in a holistic approach, and we have to be thinking about women as individuals with lives that matter and are important, and not just mothers or partners.
Yeah, and so I want to kind of segue into what the medication does to alter, your mood, because you said that that's what it does, right? It alters, how you view yourself, and it can help improve, how you view yourself, right? And so take us into what the medication does to the brain, because we talk about, and when I'm in session with you, we talk about medication in conjunction with therapy, doing
Right.
it both ways. Because when the medication was offered to me, by the psychiatrist, it wasn't with therapy. It was like, here, take this medication. And then that was it. And so I was like, do I come back and talk to you? He was like, no, you'll be fine once you take this medicine. And so I'm like, well, I don't know that, can I come back? And so those type of things in my head was just like, you just want me to take a pill and then that's it. But now that I'm learning different, right, that the medication goes along with, right, the therapy parts of it, because I think it'll help it work faster. And that, correct me if I'm wrong.
Yeah, I think, it's when you look at the studies, it's a little bit different for kids than it is for adults. For children, and adolescents, if you look at kids who just take the medicine, kids who just do therapy, and kids who do therapy and medication, the kids who do the therapy plus the medication do better than the kids who just do the therapy or just do the medication. Um,
So that's gonna be
for
cute. Should I gonna be able to edit this out?
the cats are
Yeah.
important. Um, for adults, it's a little bit different in that oftentimes with depression and anxiety, depending on how severe the symptoms are, if they're not too severe, an adult could just take medication or just take therapy or do both, and it's about the same. So sometimes medication can really work on its own. Um, However, I will say that when they look at those studies, the people who are taking medication on their own do see their psychiatrists pretty often, once a month. And so it's not really only the medication, it's having that support of somebody that you can talk to, even if it's just brief, even if it's just, a 30-minute visit once a month. That extra support is really helpful. In terms of just in and of itself, the support can help with mental health, but also it's helpful. I think it's really important when people are taking medication that they have someone that they can talk to and really understand, is this medicine helping me? Am I having side effects? What do I do if I'm having a side effect? And just having that maintenance, and that ability to talk with somebody. The medication, so it's interesting when talking about how the medications work. Most of the medications that we give in psychiatry, were actually, at least initially, developed to treat something else. And then they noticed that, oh, it seems like when we give this medication to treat this other disease, it helps someone with their mood or it helps someone with their anxiety. And then they would go and move forward and say, okay, well, let's give it to lots of people who have depression or anxiety and see if it really helps or if that was just, a one-off thing. And so it's not really that somebody is looking at what causes depression or anxiety and then finding a medication to target that, if that makes sense. So we know how the medication works. We know how the medication works, but we know less about why the medication works. So we know how it works, we know that it works, we know a little bit less about why it works. And we know a lot about safety, especially medications for anxiety and depression. They've been around for decades, so we have lots of data to show us that they're safe taken long term. Um, so what the medication actually does in someone's brain, it's complex because brains are complex, right? They
Right.
control everything about someone's body.
Hmm.
And so, that's a lot of what is attributed to why we don't know why the medication works, is because the brain is so infinitely complex and so infinitely individualist for each person, that it's not an easy target to sort of say like, oh, this does this, and it's not straightforward, which is okay, right? That's what makes people complex and wonderful.
Right.
It's our wonderful complex brains. So the medications that treat anxiety and depression, the first line medications that we use are called SSRIs, or selective serotonin reuptake inhibitors. These are really common medications that many people have heard of. Fluoxetine or Prozac is one of them. Escitalopram or Lexapro is another one. Sertraline or Zoloft is a third medication. These are very common medications, some of the most commonly prescribed medications in the country. Um, and what these medications do is they impact serotonin, which is a chemical in our brain that sends messages. And people with depression and anxiety don't necessarily have less serotonin than people without depression or anxiety, but
Hmm.
they do better if they have more. So the way the medication works is it makes more serotonin available in the
Okay.
brain.
Hmm.
And then it also, so that's step one, and then it also helps the brain sort of restructure itself so that it has more sensitivity, that it can receive the serotonin better. And so you can see these changes in someone's brain when they take the medication. And the medicine, when someone has depression or anxiety, obviously it's from the brain, and it's not necessarily that someone's brain is, like I said, it's not necessarily that they have a chemical imbalance or that their brain is working incorrectly. It's more that the way that their brain is working is causing these symptoms, and so making these changes and these adjustments with the medications can be helpful. And it's not just the medications, right? There's also good evidence to show that when people go through the therapy, their brain also makes positive changes. And so it's really a positive thing that we're helping to change the brain, and helping the brain to work in a way that lets somebody really not experience these symptoms and live their life fully.
Okay. And so one of the things I wanted to ask you is how would a parent know if the medication was good for their child or not? If the behavior's improved or something changed, like how.
So as I had said before, I'm a very big advocate for close connection to whoever's prescribing the medication, because that is the best way to know that the medicine is working. So when someone starts a medication, usually a provider will recommend a medication based on how severe the symptoms of anxiety or depression are. If a child has mild depression or anxiety and it's not really affecting their life that much, then it's best to start with therapy. But once they reach that moderate or severe, which really means that they're having a lot of symptoms and they're really not able to live their life, they're not able to go to school, they're having lots of suicidal thoughts, so we're concerned about their safety, then medications can be really helpful in combination with therapy. And so those are the group of kids that we say, medication would be a good choice, and it has the greatest likelihood of helping the symptoms go away and your child to live their life, and be able to be engaged in their life. Um, and it's really important in that first visit to have the discussion, to the question that you just said. How will I know if my child's doing better? What are my goals? And it can look really different. It's important for that to be individualized. It can look
Hmm.
really different from child to child. So if there's a kid who, before was playing in the band and they quit their instrument, okay, well, I know that my child is going to be better if they're doing these activities that they enjoyed more. Or if they're not going to school, I know my child is going to be better if they're doing these things that they
Hmm.
used to do, or
Right.
that they're supposed to be doing better,
Hmm.
easier. If a kid is having tantrums, I'm looking for less tantrums. Really setting the goals based on what are the symptoms that the child is having. And then there's another thing that we also will do sometimes, which I find very helpful, and we call that measurement-based care.
Hmm.
And so what that looks like is that when somebody comes in for an appointment, we'll give them a form. I'll give them a form that they can fill out, a questionnaire. I'm looking for one since I'm sitting in my office. Um, And, it's a questionnaire that has a list of symptoms of depression on it. Um, and they fill out the questionnaire and on their first visit, and then they take the medicine, and then every time they come back they do another questionnaire. And so in the first visit we have a number, and you say, okay, your score on this measure was a 23, and then they come back a month later and, okay, now it's a 20, and you can kind of follow that over time. And even if it's not all of the symptoms that are a problem, it can give you another thing to track over time. So that's really, in terms of how the medication is working, it's about setting goals, talking to the family about how they're feeling, and doing some of these concrete measurements to track over time.
Yeah, that's great because a lot of times when people get they start talking about, medication with children, um, that's kind of like what we think of, right? How long, right? Um, will the children even be on the medication is the
Yeah,
is the next thing, right?
for sure.
Because
Yeah.
when you're thinking about them taking the medicine, you want to know like what the effects are going to be, if I'm going to see some improvement, what an improvement's going to look like. If it's bad, what does that look like? And the like the coin piece, like the centerpiece is how long, right? Will the medication be needed? Um, because you're thinking about long-term medication use, again, it's something taboo, right? Which is, people take stuff all the time, right? For one reason or another, to live a life that's fulfilling to them. And so as a mother, as a parent, what would you, caregiver, what would you do, if your child needed to be on long-term care medication, or, you saying, okay, well, we see improvements, so now you can come off, but the behaviors come back. I'm sorry, I'm just like throwing a bunch of stuff at you because it's like in my head, it's like, Yvonne, speak this out.
No, it's actually one of the most common questions that I'm asked is when can we stop the medication? How long should someone be on the medication? And so I usually give that information up front without even people asking, because most people want to know. And the first thing is, just like any medication or any treatment, it really has to be individualized to each person.
Mm-hmm.
So, we take each child individually. There are some guidelines that we follow, however. So for the medication, I think the first thing that's important to know is that it does take some time for it to start working, about 4 to 6 weeks, for people to really start noticing effects. And then even without changing the dose, if someone's doing well on the medication, they can keep getting benefits up to 3 months out. So it is, when you start a medication, it's a process that really is about finding the best fit for each individual person. So
Mm-hmm.
sometimes someone will start one medication and maybe they'll have a side effect, or maybe it isn't helpful and they'll need to switch to another medication, because everybody's different and everybody's body processes the medicine really different. So it's important to be with a provider that's thinking about you as an individual, and what medication is a good fit for you, what medication isn't a good fit for you, and also being willing to be flexible and understand that it might take some time to find the correct dose, and the correct medication, the correct type of medication or specific medication. Um, I think that's something that's also really important to know, is that oftentimes the dose will change of the
Mm-hmm.
medicine, especially for kids, but also for adults. We like to start at a lower dose of the medicine, to let someone's body adjust to it. And this really prevents and can minimize someone having side effects to the medication. So we start at a smaller dose and then increase it slowly over time. So it's not a bad thing if your doctor says, okay, we need to move on to the next dose. It doesn't mean the medicine isn't working. It usually just means that you want to get up to a treatment dose. And
Mm-hmm.
so that's how it starts in the beginning, is finding the right medication, finding the right dose, and then doing some of those things that I mentioned in terms of tracking how someone's doing, if someone's better. Um, and you really want to treat someone until their symptoms are mostly, if not all, gone.
Mm-hmm.
And we call that remission.
Mm-hmm.
The reason we want to treat someone until remission is because that decreases the chance that the symptoms are going to come back. That decreases the chance for a relapse. And so that's the target of treatment. Like, let's give you the medication and give you enough of the medication that your symptoms are all or mostly gone. And once someone's at that point, that's when the guidelines that I mentioned in terms of stopping medication come in. So for people who when they get to the point of their symptoms are in remission, It's most helpful for them to stay on the medication for a while. For people with depression, at least 6 months. For people with anxiety, at least 12 months. And what this does is it provides somebody with the best chance of the symptoms not coming back later on.
Okay.
So not having a recurrence. We call that a recurrence when the symptoms go away and then they come back. And so, taking that medication for that 6 months or that full year can prevent that from happening. And so I always say that everybody who this is their first episode of anxiety or depression or their first time with medication, once they've hit that 6 month mark or that year, deserves a chance to see, can we decrease the medication? The biggest risk of decreasing the medication is that the symptoms will come back, like you said. Sometimes people might feel uncomfortable physically when they come off the medication because their body's used to it, but it's not a dependency or withdrawal like we think about with some illegal substances. It's not that sort of thing. It's just that sometimes the body just needs to adjust to not being on the medication. It's not dangerous. But it can be uncomfortable, and so that's something that's also important to talk to someone's provider about, because there's lots of things that we can do to help that discomfort. Um, and so sometimes if someone's at that 6 month part or that 12-month part, that's when it's good to have a conversation like, is this the right time for you to stop taking the medication? Like, I work with children and young adults, and we'll often be at the point where someone meets that 12-month mark, but they're going into high school or they're going into college, and they say, I think it would be helpful if I kept the medication because I know that I'm starting a new stressful, I'm starting a new job.
Right.
And it's okay. As I mentioned before, the medications have been around for a long time, and so we have lots of evidence to say that people can take this medication for decades and there really aren't long-term harms. And the only reason to stop it is that, there's no reason to take a medication that you don't need. So that's the reason to sort of try to stop it. But if someone's really in a spot where they feel like, this is a stressful time, I want to keep my medication, that's okay too. There's not going to be long-term harms for that. And then the other thing to also consider, I mentioned if this is someone's first time with medication or first time with anxiety or depression, especially for depression, sometimes people will have one episode their whole life, sometimes people will have multiple episodes. So we know if someone has one episode of depression, there's a 1 in 2 chance that they'll have another one later on in their life. When someone's had 2 episodes of depression, there's a very high chance that they're going to have a third one and a fourth one. And so for that group of people, it can be helpful to just take the medicine regularly to prevent future episodes of depression, and just have that be part of one's regular health routine.
You just taught me something, because I did not know that. If you experience depression multiple times throughout your, for children, going through adolescence, that it could really be an occurrence that happens more frequently. And which is, now you put me back, in time when my children were younger, and I saw these things because of the conditions in which we lived. And so it's like being at the table and being in the space, and I hear some of the stories that sound similar to mine. It really is, to me, in hindsight, what could have been prevented, had I known this information. And, like moving forward, how I could have been more of an advocate for my children, when they were going through things, because I was going through stuff, because life doesn't happen in a vacuum. We all live in the same house, and so that's part of the child's environment, when there are things going on that affect the parent, right? And so it does affect the children. And so they're looking at this, they're feeling some type of way, and so now it's like, what does anybody do, with these type of situations, when it constantly keeps repeating because you didn't receive any assistance, any help. And so what I did was, and I just want to share a tip or two, because I didn't have medication. And I needed it, to be quite frank with you. I know I did. Going through psychology and learning about, mental illnesses, they say the first person you diagnose is yourself, because, you'll see yourself. And so I did. I went to church a lot, and I testified. I talked about, some of the things that I went through. I didn't get very deep until it was like a women's retreat we had at our church, and women spent the night overnight. And I had to admit that, I was in depression, and I needed some help, with my family. Um, and still, I did not go, to a mental health professional because of my previous experience, with medication. And so my thought process was completely off, and I suffered a lot. And so when a parent suffers and the children suffer too. Um,
Absolutely.
and so we went to church. I started doing, some social activities, just to get outside. And I tried to find a babysitter for 6 children. It's really tough
Yeah.
to get that break, to regulate yourself, and to get into a safe space. And so now what I do, because I still got 6 children, they all survived, uh, is I'll go off, to the park and sit, listen to some music, dance, read, take a bath, light some candles, favorite scents, going for a walk, being out in nature, getting some sun in my face, you know, because as I started learning, these were some of the things that were helpful to me. And then I started doing therapy, and that was really helpful. It was super, super helpful. Um, and thankfully, I was beyond the point of not looking at therapy as a way of saying that, I didn't need it. It was very helpful, you know, and I don't know if I could get medication or go on medication. That's a conversation for me and the doctor, right? But it's like once you start experiencing the depression, and now since you told me that when you've had multiple episodes, it does come back frequently. And so these are some of the things that I do when it does happen. You know, I go to the water, I go outside and sit. And then I got you all, really honestly, Thursdays are my favorite day and event, when I get to sit at the table and talk like this and have these moments of, aha, you know, because when you don't know, that there's help out here, when you don't know that it's professionals like yourself and Dr. Suarez and Dr. Adil and, Roberto and, the whole crew that's so open and honest with these conversations when we talk about, you know, um, mental well-being, in the communities that you all service. Because these things do progress, when it's not taken care of, and it could lead to, some serious consequences. Um, and so I just wanted, I didn't want to just throw it on you like that, but it's like,
No, yeah, I'm glad that you said that. Um, because, and it's making me think about what you had said earlier about, you went to the doctor for the medication, and the doctor said medication, and you'll be fine. Like, you don't need to come back, you'll be fine. And that's very often not the case, right? And we talked a bit about what medication can do, but we didn't talk that much about what medication cannot do, right? And so medications can help with the symptoms of depression, but they can't change someone's environment, right? If someone's going through bullying at school or trauma, or anything, the medication isn't going to do anything about that. And so we really have to think about medication as one part of someone's
mhm,
treatment when they're going through something. And we have to look at the community, the environment, the family, and really do what we can to support the whole patient. And so what we call that a holistic approach. And so,
mhm,
medication is one part, therapy is another part. You brought up so many things that are part of the treatment plan. Things like community support, like churches, are so important. In terms of recovery, and ongoing support, friend support, women's groups, social groups, exercise, getting sun, eating
mhm,
healthy, right? Keeping our bodies healthy. All of these are different parts of the puzzle that help someone to be at their best mental health. And depending on the person, some parts might be bigger or more important, and depending on the medical problems, like, if it's very severe depression, then they might really need the medication to be a larger part. But some other people, depending on the situation, if they're in a tough situation like at school, then maybe the largest part really needs to be school support, and getting individual education support at
mhm,
school, or
mhm,
bullying interventions at school. So really, depending on each individual, the pieces get bigger or smaller. And you have to, in order for the medications to be successful and the treatment to be successful, it's really important for the doctor to understand all of the different parts, And also, you mentioned Thursday and our amazing team in the stress and anxiety disorder clinic. And that's another really, having that provider team approach so that you can have somebody like me who talks about medication, and the other clinicians, understanding, we have social workers, understanding the social environment, and the psychologists really thinking about all of these different puzzle pieces that go into somebody's life and somebody's recovery. And having that team approach is really helpful and really important.
I love it. It's like I talk about you all the time, and it's such a beautiful experience for me being in the space um, because I have questions like this and because I can relate to, reluctance, right? Because of, the experiences that have been handed down, generationally through, our families, the oral histories that, we tell ourselves and we tell our families because these are our experiences. So, the lived experience matters. And so, when I was asking you about the medication and different things like that, and then how you report it, the patient is 100%, the pie of getting better.
Right.
So what pieces you need to take to, get you better is the pieces that you use. And then if you try something and you don't like it, you report back. You say, well, this didn't help, or this was very helpful. Can we do more of this and less of this? You become your own advocate for learning how to be how you want to be in your life to, be successful and whatever that means to the individual. Because that's what I'm doing when I sit down at the table. I take what I need, to help process some of the things that I go through and what my children went through, because it's all in hindsight because they're all grown. Um, but it's very helpful to me to get this information for me to even understand what they went through,
Yeah.
being with me, because parents bring their children in. I didn't bring mine in. I was like, don't go talk to nobody, um, we're going in house to in house, so
Yeah.
you didn't really feel that open and free,
Right.
to have these type of discussions. And I, like I said, I probably could have benefited from the, medication. And
Yeah.
so learning how to be regulated, so that I don't traumatize, my children. I think I traumatize them a little bit. That's a little, but
Well,
these
that's one of
these type of things are just necessary to talk about and kind of
Mhm.
air out. It's one of my elephants in the room. That I didn't want my children to be on medication. Because of that experience. Because I was pregnant. That was my third child, and so just from that point on down, as life kept getting harder and harder for me, depression really was a thing. And so if I experienced it, then chances are I put my children through that too. And I didn't get them any help either. So they suffered with me. And now I want to change the story. I want to change, how we can be more of a community resource for everyone that's looking to heal, from whatever it is that they're experiencing in their environment, all the tools that can be used to get there.
Right. Yeah, it's important. And it makes me think about our team and how important it is to have our team. Because I do really think it's the provider's responsibility to create an environment, and I think our team helps us be accountable for that, to create an environment where patients can come in and they can express how they're feeling, the families really having the whole family feel supported and understand, like you said, it isn't a vacuum, and the different members of the families do interact with each other, and families being able to ask the questions that they need and get the answers that they need to help them make the best choice, and understand why medications could be helpful, why your provider is saying that you should take medications, and what you can expect from the medication. And something that we haven't talked about yet that also comes up very often is side effects, right? And
Oh
will
yeah,
I
yeah, yeah.
get side effects from the medication? And I think there's a lot of things that go into people's concerns. There are many people who have had family members that take medication, that have caused problems. I think there
Mm-hmm.
certainly was a time in the past where the idea in the community was if you're taking a medication and you have side effects, that's how you know it's working. And that's not necessarily true. Um,
I've heard that
so,
one.
yeah. So for these medications, side effects are rare. They don't happen that common, and for the majority of side effects, they're not harmful, but they can be uncomfortable. You know, if someone's constantly
Mm-hmm.
having headaches or feeling dizzy or their stomach is upset, it can be really uncomfortable depending on how much they feel that way. And so it's really important to talk with someone's doctor or to talk with your doctor and say these are the side effects I'm having, and understanding how that affects someone's life, right? So somebody might be taking a medication and feel like my anxiety is so much better that I'm okay with that my stomach is upset for a little bit in the morning, and I can take the medication with food, and it's worth it. Someone might say that that's not what I need right now. I need to try a different medication. I need to do something different because this side effect is too much. There are some side effects that are more common in kids that I think oftentimes can be scary for families.
Mm-hmm.
Um, so these medications have what the FDA calls a black box warning on them that says it has a risk for increased suicidal thoughts in children and young adults. And it's really important to understand that warning. So really what that warning is saying is that they did some studies and they found that children sometimes, rarely, when they take this medication, they might have thoughts about death or wanting to end their life. It's never been associated with somebody actually committing suicide, and it's important to understand that in the context of the world we live in which that suicide is the second leading cause of death in children and young
Mm-hmm.
adults, and that's not from the medication. In fact, when that black box warning came out, there was a very clear trend that less and less doctors were prescribing SSRIs, and more people were becoming suicidal and attempting suicide or completing suicide. So we know that these medications really do treat suicidality as it relates to depression and anxiety, but we also know that these medications can cause side effects, and this again is one of those reasons that it is very important to have a provider who will see you regularly, and who you can, to understand how can I communicate with my provider, how can I let my provider know if I'm having these side effects so that they can take me through the next steps of what to
Mm-hmm.
do. And it's also really important for providers to create an environment that people feel like they can approach you and say, like, these are the side effects I'm having, or these are the effects that I'm
Mm-hmm.
having. Should I be
Exactly.
concerned? Do I have to change the medication? Do I, decrease the dose? Like, what are the next steps? And having that support really does help somebody um, take the medication regularly and get the benefits from the medication. I think it's also important to say that oftentimes people will have side effects when they start the medication and they go away over time. So again, it's really about that close communication with each other, parents and their kids, the families and the providers, to really know, for each individual, what makes sense and what doesn't make
Kelley, you did such an excellent job explaining this. And as all the thoughts, it's like running off in my head, I was thinking there's definitely going to be a part two to this, um,
sense.
because there are a lot of things too that you mentioned, and we can go on talking forever. We really can,
Of course.
because this is a very important topic to, not just for me, but to the community at large, and especially parents and caregivers who might be experiencing this in their own lives. And so I don't want to overwhelm folks because
Yes.
like I said, I had fire off questions in my head. And so I know there's going to be a part two to this, um, because Dr. Swears and I were starting to talk about suicidality.
Oh, sure.
Okay, right. So, and since you kind of, touched on it already, that's gonna be the part two. And since, you brought it up, I want to do this with you.
Yeah, I think it is a very important topic, more increasingly so. Really, I think it would be great to do part two because we really have to be thinking about this and vocal about this because we need to protect our children.
We do. And as a mother of six, and a grandmother of two, I am really invested in seeing the futures of our children change and them getting all of the resource and access that they need to do so, while also seeing the benefits and helping the parent and helping the family as a whole. because that's what builds community. And that's what I'm out here doing as a community engagement coordinator for the Urban Youth Trauma Center, is connecting with the community. And the first community that I connect with is my family, and understanding and giving grace, mercy, and love to myself first, for what I went through, and then for what they went through, living with me. Because I have to honor that always,
Absolutely.
you know, and it makes for a great conversation these days.
Absolutely.
And
Yeah.
and I absolutely love that you took the time out to talk to me, Kelley. Thank you, thank you, thank you so much.
Of course. Yeah. It was wonderful to talk to you. And we'll
Okay.
talk soon.
Any parting words you want to give, before we wrap this up?
I think that I would say that what you just said, that families and parents are there on the front line protecting their kids, and having a prescriber, whether it's a psychiatrist or a primary care provider, they should feel it. The family should feel like the prescriber is on their side, protecting their kids, part of the team, and that's the goal.
Teamwork makes the dream work.